if you take the example of diabetes, what the GP has to do is to register the ICPC diagnosis in this patient's file. And when more than a year has passed since you saw that, since you last made a yearly control of that diabetes patient, a pop-up screen will come up when you put the ICPC code, and you will have to fill in this form together with the patient. All the other data from your data set may be transformed, it may be transferred to the database without you doing anything. This is a pop-up screen for diabetes. So you can say, can I use this one? Yes. There you can tell whether the yearly control is being taken care of now, and whether this patient is actually being controlled in practice or in a diabetes ambulatorium. You can add the year with the diabetes start, and the number of controls and other data here that cannot be captured from the order data in the patient journal system. So you can get feedback on your data from this system. You can access your data through a secured channel, and and I'll show you what you can see there. There are 30, but at this time there are 42 different quality reports about different diseases that you can find in there about your work, your own work. So these are the reports. This is the page where you can see the different reports. There's one about stress, anxiety and depression, chronic obstructive lung disease, heart failure, diabetes, CVD. There are many other reports. For doctors who are sentinel doctors, these ones, they're the ones who put ICPC codes on 70% or more of all their consultations. They can get access to additional reports where you need a bulk of codes in order to be able to generate the report. There are some here, as you can see. These are frail patients, risk of osteoporosis, and risk patients. You'll find a list of your risk patients for influenza vaccination. You can and many other things. Also your child vaccination stuff will be in here, so you can find places where you're lacking in your work. So this is the report. This is a demo report of diabetes. So this is a practice report of diabetes. You can see here's the personal identifier. Here's your age. Here's the APHC. Here's the treatment. Where the treatment is, who's the treater. Here's the serum cholesterol and the urine albuminuria, and whether the person is getting a lipid-lowering drug, and the blood pressure and whatever. If you double-click on these, it will sort on this. So you can sort your patients, and you can find. So if you want to see how many of your patients are badly controlled concerning blood pressure, you just double press there, and you get the list sorted on that. You can do that for all of them. And here you can see the date of the last annual control. So this is actually valuable. You can use this in your practice to better your care. These are the benchmarks. You benchmark how many diabetes patients you have, so you can benchmark whether you're good or whether you are supposedly good or not so good at tracing diabetes patients. And these are the different values with benchmark for all, for 50 practices close to you, and for your own. So so you can see how many people have been checked for this parameter within the last 6 months and now and national. So there are lots of benchmarking data there. Patients can also access their own data through the personal code. So they can access these data, but what is more interesting is that when they access the data, they get a letter in Danish about how they should interpret the data, and these are, and you can show why, and they can get information by clicking on these. They can get information on why this parameter is important, and what's more important for the use with the control with the patient is this spider web thing, where you can see, the single patient can see where he or she is. They supposedly should be within the green area. So these are optimal figures, and these are the actual figures of this patient. So you can use this to discuss with the patient the goals for maybe the next year. And indeed, many of my colleagues do use this. So we get overview of our population. It's really nice to get that, and it's nice with the benchmark, and it's nice with the graph of results for the patients, and the reports are updated every day. Now I want to show you the implementation of this in general practice in Denmark. In Denmark, we have 5,500,000 people. We have around 3,600 general practitioners in 2,200 practices. We have around 1/3 solo practices, around one third there are 2 general practitioners, and 1/3 there are larger. Since 2005, it has been possible to work with the system, but very few did at the start. In the old contract, it wasn't really attractive financially to go into this. And rumors were also going around that and partly true, that it may make your EPR go down, and that it was difficult to work. It has of course been, like any IT development, it has been easier and easier to work it, but there's still start difficulties when you get on.